If you often feel low back pain during everyday movement, there are a few core exercises you absolutely need to know. In Part 1, we covered the three most fundamental core exercises: diaphragmatic breathing, pelvic tilt, and dead bird. In Part 2, we move on to the next level with the butt dog and side plank. Now, in this final Part 3, we'll connect that core stability to real-life movement, focusing on the last stage of training, returning safely to everyday activities. Before we begin, let's take a moment to understand the four key deep core muscles that must function properly. If you truly understand how these muscles work and train them correctly, you'll be able to build a strong, stable core much faster than most people. And most importantly, it can help you live your daily life without back pain. The transversus abdominis is the deepest of all the abdominal muscles. As you can see, it wraps around your torso like a corset. Even if your outer muscles are strong, if this inner corset becomes loose, it cannot generate enough internal pressure to stabilize the spine. And when that happens, your spine becomes unstable, so this is an extremely important muscle. At rest, the transversus abdominis is quite thin, about 3 millimeters. When it contracts, it should increase in thickness by around 20 to 40%, reaching roughly 4 to 5 millimeters. However, in most people with chronic low back pain, there are three key problems with this muscle. First, it does not activate at the right time. In a well-trained system, the transversus abdominis activates just before you move your arms or legs, stabilizing the spine in advance. But in people with chronic low back pain, this activation is delayed by tens of milliseconds. That small delay allows the spine to move slightly, and over time, that leads to pain. Second, the contraction is too weak. Normally, the muscle should thicken by about 20 to 40% when it contracts, but in chronic low back pain, this increase is reduced, meaning the muscle cannot maintain enough intra-abdominal pressure. As a result, the spine is less supported and pain develops more easily. Third, the muscle cannot maintain contraction for long enough. In a healthy system, the transversus abdominis stays active throughout movement, keeping the spine stable. But in chronic low back pain, it tends to switch up too quickly. That's why some people feel fine at first, but develops pain after standing for a while or repeating movement. You've probably seen many people like this. So, if your transversus abdominis 1. Activate too late, 2. Contract too weakly, and 3. Cannot sustain that contraction, then low back pain is almost inevitable. But the good news is this: with the exercises you've learned today, all three of these problems can be improved with consistent practice. The second key muscle is the multifidus. The multifidus is the deepest muscle along the spine. Its role is to stabilize individual vertebrae, acting like a series of small anchors that hold the spine firmly in place. Before you even move your arms or legs, the multifidus activates automatically, almost invisibly, to prevent your lower back from moving unnecessarily. If the larger muscles are the engines that create movement, then the multifidus is like the bolt and screw that keeps everything stable. In a normal situation, for example, when you reach out to grab a cup, the multifidus contracts very quickly before the movement begins to stabilize the spine. This allows your arm to move smoothly while your lower back stays stable. However, in people with chronic low back pain, this timing is disrupted. The multifidus may activate too late, too weakly, or it may not stay active long enough. As a result, even small movement of the arms can cause subtle instability in the spine. Over time, these repeated micro-movements accumulate, leading to persistent pain. Another important issue is structural change. In many patients with chronic low back pain, the multifidus becomes thinner and is gradually refreshed by fatty tissue. On MRI, A healthy multifidus appears dense and well-filled, whereas in chronic pain patient, it often looks shrunken with areas of fat infiltration. In this state, it's not just muscle strength that's reduced. More importantly, the muscle loses its ability to activate at the right time. That's why in clinical practice, we do not train the multifidus in isolation. Instead, we train it together with the transversus abdominis, diaphragm, and pelvic floor, forming a complete 360-degree core stabilization system around the spine. Exercises like the bird dog and dead bird are excellent examples. When performing a bird dog, the multifidus should activate first to stabilize the spine before the arm and leg move, and then maintain the stability throughout the movement. With repeated practice, your body learns this pattern, so that the spine stabilizes automatically before movement. Clinical studies have shown that this type of training not only reduces pain, but can also reduce the recurrence of low back pain by up to threefold after an acute episode. The third key muscle is the diaphragm. The diaphragm is not just a breathing muscle, it plays a critical role as the top lead of your core stabilization system. It sits just below the rib cage, forming a dome-shaped ceiling. Below it is the abdominal cavity, and further down is the pelvic floor. Together, these structures form what we call a pressure cylinder. In a normal situation, when you inhale, the diaphragm moves downward. This expands the lungs and draws air in. This expands the lung and draws air in. But more importantly, it also creates pressure inside the abdominal cavity, causing the abdominal to gently expand. This pressure is called intra-abdominal pressure, and it plays a key role in supporting the spine from the inside. At the same time, the transversus abdominis and pelvic floor muscles work together to maintain this pressure, allowing the spine to remain stable and controlled. For example, when you lift something heavily or quickly change direction, the diaphragm moves down just before the movement begins, helping to create this internal pressure. Then, the transversus abdominis and multifidus engage to stabilize the spine. So, even though it feels like you are using your back, your spine itself stays stable and protected. However, in people with chronic low back pain, this pattern is often disrupted. The diaphragm may not move downward properly, leading to shallow chest breathing instead of diaphragmatic breathing. In addition, the coordination between breathing and core muscles is impaired, so adequate pressure is not generated. As a result, even though the movement may look the same from the outside, the spine lacks internal support. This makes it more prone to subtle instability, and over time, even small stretches can trigger pain. Another important point is that the diaphragm does not only work during inhalation. During exhalation, it does not simply relax completely. Instead, it maintains a controlled level of tension together with the transversus abdominis to help sustain intra-abdominal pressure. That's why in core training, the goal is not just to take a big breath-in, but to create pressure as you inhale and maintain the pressure as you exhale. Clinically, core training that includes diaphragmatic breathing has been shown to reduce pain and improve function. When proper breathing is restored, it also activates the parasympathetic nervous system, reducing pain sensitivity and helping patients feel more relaxed and confident in movement. In the end, the diaphragm's key role is not simply breathing, but to create internal pressure while breathing, stabilize the spine from within, and allow safe, controlled movement. Finally, the first key component is the pelvic floor muscles. The pelvic floor muscles form the bottom of the core system. If the diaphragm is the top, the transversus abdominis wraps around the sides, and the multifidus suffers from the back. Then the pelvic floor acts as the base that prevents pressure from escaping downward. All four of these muscles must work together to form a complete pressure cylinder. In a normal situation, when you inhale, the diaphragm moves downward and creates intra-abdominal pressure. At the same time, the pelvic floor does not simply relax. Instead, it gently lengthens downward while maintaining elastic support. A helpful way to visualize this is like a trampoline. When a ball drops onto it, the surface gives slightly but still supports the weight without collapsing. In the same way, the pelvic floor responds to pressure by adapting while still maintaining support. As you exhale, the pelvic floor works together with the transversus abdominis to contract gently and help maintain that pressure, contributing to spinal stability. This function is especially important in everyday movement. When you lift an object, change direction, or stand up from a seated position, the diaphragm creates pressure, the transversus abdominis and multifidus maintains it, and the pelvic floor supports it from below. Only when all four of these muscles work together can the spine remain stable during movement. If the pelvic floor is not functioning properly, that pressure leaks downward and the entire core system becomes unstable. In people with chronic low back pain, this coordination is often disrupted. The pelvic floor may be too relaxed, providing insufficient support, or overly tense, interfering with natural breathing and movement. Timing is especially important. If the pelvic floor does not lengthen properly during inhalation, or fails to contract properly during exhalation, intra-abdominal pressure becomes unstable. As a result, even small movement can lead to subtle instability in the spine. Over time, these small instability accumulate and make pain more persistent. That's why pelvic floor training is not just about tightening the muscles. The key is to restore the natural timing, allowing it to lengthen during inhalation and gently contract during exhalation in coordination with breathing. This coordinated pattern is essential for building a stable and a functional core. Now, at this point, you've essentially become expert in the deep core muscles. So, the exercises I'm about to show you will make much more sense. 1. Standing core training, diaphragmatic breathing. Whether you have chronic low back pain or not, diaphragmatic breathing is the most fundamental and essential core exercise for stabilizing the spine. It's not just about breathing. It's a process of retraining your core stabilization system through breathing. Surprisingly, many people are not doing this correctly. The easiest way to understand it is in 3 steps. Standing diaphragmatic breathing is especially important because it directly connects to real-life movement. When you're standing, gravity and body weight are involved, so you can train the core in a much more functional way. First, the starting position. Stand with your feet about shoulder width apart. Keep your knees slightly relaxed, not locked. Maintain a natural lumbar curve and keep your gaze forward or slightly upward about 10 to 15 degrees. You can place one hand on your abdomen and the other on your chest to better feel the breathing. Now, slowly inhale through your nose for about 3 to 4 seconds. Your chest should not move much. Your abdomen should gently expand. As you inhale, the diaphragm moves downward, creating intra-abdominal pressure. At the same time, the transversus abdominis and pelvic floor are already lightly activated, preparing to stabilize the spine. Next is the key phase, connecting breathing with core activation. While maintaining that internal pressure, slowly exhale through your mouth for about 5 to 6 seconds. As you exhale, your abdomen gently comes in, but without force. During this phase, the transversus abdominis increases its contraction to maintain intra-abdominal pressure and support the spine from within. At the same time, the multifidus stabilizes the spine segment by segment, and the pelvic floor provides support from below. All parts of the core system are now working together as one unit. The important point here is not to forcibly pull your abdomen in, but to maintain a natural controlled tension while continuing to breathe. The 3rd step is repetition. While standing, continue this breathing pattern. Short inhale, long exhale for about 10 repetitions. During this time, your body should remain stable without unnecessary movement. The transversus abdominis, multifidus, and pelvic floor continue to working together to maintain intra-abdominal pressure. This is the phase where you build the ability to stabilize your spine during real-life standing and movement. Perform about 2 to 3 sets per day. For this type of core breathing, the most effective method is to inhale through your nose and exhale slowly through your mouth. Nasal inhalation helps activate the diaphragm and create a more stable breathing pattern, while mouth exhalation makes it easier to engage the transabdominis and maintains pressure. Once you become more comfortable with the technique, you can transition to natural nasal breathing in daily life. However, during the training phase, inhaling through the nose and exhaling through the mouth is the most effective way to learn proper control. The second exercise is the sit-to-stand movement from a standing position, what we commonly call a bodyweight squat. This is a core exercise that directly connect to real-life movement. The key is to set your core first while standing, then maintaining that internal pressure as you lower down and come back up. Although it looks like a regular squat, it's not just about using your glutes. It's an integrated core exercise where your lower body moves while your core remains stable. First, the starting position. Standing with your feet about shoulder width apart, with your weight evenly distributed across your entire foot. Keep your knees relaxed, not overly steep, and maintain a natural curve in your low back. Look straight ahead. From here, inhale slowly through your nose for about 3 to 4 seconds. As the diaphragm moves downward, intra-abdominal pressure is created and your transversus abdominis, pelvic floor, and multifidus are all prepared and rightly activated. Next is the lowering phase. Slowly exhale through your mouth over about 5 to 6 seconds as you lower yourself as if sitting down. At the same time, allow your knees to move slightly forward while your hips move back. During this phase, the transabdominis maintains intra-abdominal pressure, the multifidus stabilizes the spine, and the pelvic floor support from below. Your torso should remain like a solid column. The movement should come from your hips and knee, not your lower back. As you lower down, make sure your spine does not round or wobble. This is especially important for people with chronic low back pain, as this is where the core tends to switch up. If that pattern repeats, the pain will persist. The correct movement is simple. Your spine stays stable while your hips and legs move. The third phase is a brief fold. At the bottom position, do not hold your breaths. Instead, take a short inhale and long exhale while maintaining intra-abdominal pressure and hold for a moment. This phase helps build your ability to maintain core stability while holding a position. The fourth phase is standing back up. From the bottom position, inhale briefly, then slowly exhale over 5 to 6 seconds as you return to standing. As you rise, continue to maintain intra-abdominal pressure and use your hips and legs, not your lower back. Your spine should remain stable throughout the entire movement. Repeat this sequence about 10 times for one set and perform 2 to 3 sets. In the beginning, you can start with a shallow range of motion. As it becomes more comfortable, gradually increase the depth and make the movement more natural. If you have a knee discomfort, you can modify this by using a chair. Sit down, inhale, then slowly exhale as you stand up. Once standing, inhale again, and then slowly exhale as you sit back down. This way, you can safely perform the same core training in a more supported position. The third exercise is working with core activation. This is a method of maintaining intra-abdominal pressure created through breathing while stabilizing the spine during movement. In English, this is often called braced walking. It simply means walking while keeping your core engaged, almost like walking with a natural back brace, but created by your own muscles. Step 1. Preparation. Start by standing comfortably with your feet about shoulder width apart. Do not overextend your low back, Just maintain a natural neutral curve. From here, inhale slowly through your nose for about 3 to 4 seconds. As the diaphragm moves downward, your abdomen gently expands, and your transversus abdominis, multifidus, and pelvic floor are all lightly activated and ready. This is the core setting phase before movement begins. Step 2, first step. Now, slowly exhale through your mouth as you take your first step forward. The most important point here is not to completely relax your abdomen. Even as you exhale, your core should not suddenly collapse. Instead, maintain a soft but steady intra-abdominal pressure as you begin to work. Step 3, walking phase. Now, continue walking. Do not try to match your breathing to each step. If you force a one-to-one rhythm between breathing and walking, your breathing becomes unnatural and your core will tend to switch up. Instead, keeping your breathing independent of your step. Continue a pattern of short inhalation and a longer exhalations, maintaining intra-abdominal pressure throughout. As you walk, your legs move alternately, but your torso should remain stable like a solid column. During this phase, the transversus abdominis maintains internal pressure, the multifidus stabilizes the spine, and the pelvic floor support from below. Your breathing should remain continuous and natural. If your breathing stops, your core stability will also be lost, so it's essential to keep breathing. As you continue walking, keep your gaze slightly forward, about 10 to 15 degrees ahead, and maintain a natural lumbar curve. When this pattern becomes natural, you'll find that your spine stays stable even during movement, and everyday activity feels much more controlled and pain-free. Next is the phase of controlling your speed and rhythm. At the beginning, it's important to work slowly. Rather than increasing your speed, your priority should be to maintain a stable spine without any unnecessary movement. As you become more comfortable, you can gradually move toward a more natural walking pace, even eventually trying walking faster. The same principle applies when you are cycling or hiking. Now let's move on to a building duration. Start with about 5 minutes, then gradually increase to 10 minutes and eventually 20 minutes. The ultimate goal is to maintain this core pattern naturally during most of your daily walking. Now, if you continue practicing, you'll soon develop the ability to automatically protect your lower back during everyday movement, whether you are lifting objects, sitting down, or standing up, and not just during walking, but also while carrying things, changing direction, or climbing stairs. I sincerely hope that the back pain you've been experiencing will gradually fade away.